Hello, everyone. My name is Jeff Burgess. I'm a professor at the University of Arizona and previously an emergency physician, medical toxicologist, and occupational physician. I've worked with firefighters for about 30 years now. I'm talking with you today about cancer risk in firefighters. So I'll just give you a little bit of information, hopefully how you can apply this information as well. So first, there's a lot of epidemiologic studies out there that have shown that firefighters are at increased risk of cancer. Most of those studies are looking at cancer rates now, so that's reflecting exposures that firefighters had between 3 and 30 plus years ago. So the cancer risk of exposures today for firefighters may in fact be even higher than previously. Um, Firefighters have an increased risk of a broad number of cancers. So not a single type, but multiple types, and all throughout the body, the lungs, the gastrointestinal tract, the kidney, the brain, prostate, etc. In addition, minority firefighters have been shown to have additional cancers that are not up in non-minority firefighters. So they're at a even higher risk for a number of cancers. So why is it the firefighters have an increased risk of cancer? Well, they have a number of different exposures. So first off, we'll start with the obvious. On the fire ground, many of the components of smoke that our firefighters are exposed to both from inhalation and through their skin, that's a really important source of exposure, include a number of known and suspect human carcinogens. So in addition to those exposures on the fire ground, they're exposed to other chemicals. One group, for example, would be per- and polyfluoroalkyl substances, or also known as PFAS, or the forever chemicals. Those can be present in some of the foams that firefighters use. It's also within their gear, and can be released when there's fires as well. So that's a chemical that would be beyond just the fire ground. Also, the shift work that firefighters do is also known to increase people's risk of cancer. So there are some non-chemical potential causes of increased cancer rates in firefighters. Because firefighters should therefore be considered a high-risk population for cancer, you should be considering doing screening at an earlier age than you would generally. So if you take general screening guidelines for the US population, just think about applying them early. As a really good example, you either doing colonoscopy or some type of DNA screening for colon cancer should be done before age 50 in firefighters. And this is something that is being accepted by a number of insurance agencies as well, if that's a concern. But again, they benefit from early screening. There's also some additional kind of screening tests beyond which you would find in the general public, but maybe be used in other high-risk populations like cigarette smokers. And that is because firefighters also have an increased risk of lung cancer in addition to smokers. The firefighters can be screened with low-dose, high-resolution lung CT in order to look for nodules that would be larger in size and could be followed up to see whether they represent cancer or need additional screening thereafter. So there are also, you can, since they're at risk for higher risk for other cancers, such as prostate cancer, this may be a particular reason to look at screening with prostate-specific antigen, for example. That would be something that can certainly be done in a primary care clinic, and also feel very comfortable in referring these firefighters to oncologists for additional workup for other cancers as well. So again, there's a number of resources that you can use in addition to those that are on the website for this particular project. And it's been a pleasure speaking with you.